Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Welcome to Don't Let the Old Lady In podcast. I'm your host, Lori Gardner. I'm excited to be here today to go over the ABCs of Medicare, everything you need to know. Ladies, anybody out there about to turn 65? Are you still working? Are you confused about when to sign up for Medicare and what the penalties are? You're not alone. In this episode, I will break down Medicare A, B, C, and D in simple terms, plus what to do if you're still on an employer plan. And you should learn how to avoid the most common and costly mistakes and grab your free checklist to navigate Medicare with clarity and confidence. So, we're going to dive into anything related to insurance I have found from clients is just totally confusing, and it's no different with Medicare, ladies. So I want to get some clarity, especially to those who are getting close to 65 and are not sure of it all. You probably heard terms like Part A, Part B, Advantage plans, Medigap, and maybe you're wondering, do I have to sign up at 65 if I'm still working? What happens if I wait too long? How do I avoid getting stuck with penalties? Ladies, I got you covered on this because this episode, I'll be covering all of that. So let's do a quick breakdown of Medicare. Let's start with a simple explanation of Medicare's parts, because these terms get thrown around a lot. Part A is hospital insurance. It covers inpatient care, skilled nursing, and some healthcare services. I emphasize some, because I cannot tell you how many times a client or the adult children of an elderly client come and say, well, that's all right. They have to go to, a nursing facility or Medicare cover it. No, they won't. No, they won't. So the Part A, it's usually free if you've worked 10 years and paid into Social Security. Now things have changed, so there is a deductible. So let me just keep going with all the parts. That's Part A. That's the hospital insurance. Part B is medical insurance. It covers your doctor visits outside the hospital, outpatient care, preventative services, and more. You usually pay a monthly premium for Part B, okay? So there's a cost. Then there's Part C, which is also called Medicare Advantage. It's a private plan. Now let me just back up a little bit. Part A and Part B are government-issued Medicare plans. We roll into Part C, it's a whole different ball of wax. It's called Medicare Advantage. It's a private plan that bundles A and B and sometimes D, which is the prescription plan, together. So more on this in a moment. But just remember, Medicare Advantage is the one you're seeing lots and lots of commercials on in the fall when it's open enrollment, because these private payers, these private health insurance companies really want to get you in that plan. And then Part D is prescription drug coverage. You need this unless your current plan is considered credible, meaning it is as good or better than Medicare. Just remember, I've had a few clients that got penalized because they properly signed up for Medicare A and B at 65, but at 65, they weren't on any medication. So they just thought, oh, well, then I don't need it. I get these clients at 78, 80, and they're on some medications. Well, they got to sign up for it, but they're going to get penalized for an additional monthly fee every year for the rest of their lives. So you got to sign up for that Part D, even if you're not on drugs. So what happens if you're still working at 65? Here's what you need to know, ladies. If you're still working at 65 or you're covered by your spouse's employer plan, you might not need to enroll in all parts of Medicare right now. The key is knowing what to do and when. Here's what to consider. The employer size matters. If you or your spouse employer has 20 or more employees, you can delay enrolling in Part B and Part D without a penalty. Your group plan is considered primary, and Medicare becomes secondary. You do have to sign up for Medicare Part A, though. But if the company has fewer than 20 employees, Medicare becomes primary, and you need to enroll in Part A and Part B during that initial enrollment window to cover and avoid any coverage gaps or penalties, and get in that Part D. Enroll in Part A anyway. Even if you're staying on your employer plan, like I said, it's usually smart to enroll in Part A at 65. So I just recommend all my clients just do it right out of the starting gate. It's free, and it gives you some backup hospital coverage. It's not until you then lose or you retire your employer plan that you then, quote unquote, sign up for Medicare A, B, then you're going to get hit with some costs. But note, if you're contributing to an HSA, check with a financial advisor before enrolling in Part A, because it can affect your tax deduction. So that's something to be aware of. Check your drug coverage. Medicare requires that you have credible drug coverage. If your employer plan doesn't meet their standards, you'll want to enroll in Part D to avoid lifelong penalties. Here's a pro tip. Ask your HR department to confirm in writing that your drug plan is credible. Okay? So what happens when you retire later? When you leave your job, you enter what they call a special enrollment period. This is an 8-month window where you can enroll in Part B without a late penalty. Don't wait too long, ladies. If you miss it, the penalty is 10% per year you delayed for life. Also, your employer has to fill out Form CMS-L564. You submit it with your Part B application so Medicare knows you had coverage. And I know this is actually probably starting a little confusing, ladies, so don't worry. We have our top dog insurance advocate who's wonderful. She helps everybody with Medicare. So please give us a call. It could be as simple as a 1-hour phone call to get you going. Here's the top 5 Medicare mistakes to avoid. Just let me quickly share the biggest mistakes I've seen people make and how to sidestep them. Missing your enrollment window. Even if you're still working, you need to know your timeline. Okay? Number 2, delaying Part B without employer coverage. That leads to penalties and gaps in care. Assuming employer coverage is always better. Sometimes it is. Sometimes Medicare Advantage or Medigap can save you thousands a year. So really, you got to do your homework and compare it all. There's plenty of professionals out there that can help. Skipping Part D and getting penalized by not having credible drug coverage. Really, really important to do your homework and get this done right. Failing to reassess plans every year. Medicare plans change. Drug formularies change. Premiums change. It's worth reviewing annually. So here's a little bit of a bonus freebie. The top 5 Medicare mistakes to avoid. I have a checklist that you can get. I'm going to drop it into the show notes. You can have it. But I just want to a lot of news has come out recently about Medicare Advantage plans. They're getting scrutinized all over the place. I can't go into the details now, but just suffice it to say, stay on top of the news. As advocates, both medical and insurance advocates, we have dealt 15 years worth of dealing with Medicare Advantage plans versus straight up government Medicare plans. We actually recommend the Medicare plans because of what we have seen. They can be, I only say, Medicare Advantage plans are seemingly look much more expensive, and they might say they have transportation services, dental eye. These dental eye is not covered by Medicare, unfortunately, but we have to be very careful. You have to be very careful. Remember, these are private insurance companies. And, so what ends up happening to a lot of our folks that has happened is that they're on Medicare Advantage plans. They're doing okay because they're not really expending that much money, but they get into a situation, a crisis, they're in the hospital. They have way, 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 way more out of pocket when they're in the hospital. And those are big bucks there. So you got to do your homework. Don't necessarily listen to those commercials in the fall with Joe Namath. You've got to really do your homework and get a professional to really advise you. So here's my final thought. So many women approach Medicare feeling overwhelmed and underprepared, but here's the truth. Just because you're still working doesn't mean you can ignore Medicare. Educating yourself is a powerful form of self-care. You've spent decades taking care of everybody else. Now it's time to take care of you. If Medicare feels confusing, you're not alone. The good news is, with the right knowledge and support, you can make choices that protect your health and finances. And ladies, I got to tell you, we as when we do insurance advocacy, we find Medicare hotlines are of tremendous help. Not a lot of wait times and a lot of good information. So I hope this episode helped you, and share it with somebody. Share it with all your ladies, because listen, we don't want anybody to get penalized when they hit 65, and we want everybody to be empowered and aware and be a top-notch healthcare consumer. So, navigate your health and your insurance with power and peace with the right information, right? So, until next time, please share this. Please follow me. Until next time, stay radiant, stay curious, and don't let that old lady in. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.